Folks, I went back to see my vascular surgeon today. I had another CAT scan done of the full area. Okay, so she could see a better picture of what was going on with my abdominal aortic aneurysm. And to, see if it's been growing, if it's gotten any bigger, and this and that. So this is a serious condition that you must keep an eye on. Going to have surgery. Okay. It's gotten larger, and it's at the point right now where if it gets any larger, they're going to have to open up my chest and fix it that way. But right now, they can make 2 incisions in my groin about that big and go in that way and place in some stents in my aorta. Okay, I'm going to put some diagrams up here on the screen to show what I'm talking about. It's my aneurysm is unexploded. It hasn't burst yet. If it bursts, I'm going to bleed to death inside. Okay, right now my aneurysm is right above. Let me get the diagram she painted. She showed me. My aneurysm goes from right above my diaphragm down right below the blood supply to my liver and my stomach. Okay, so I'm going to have a stent grafted or whatever from above in my main aorta, from above my diaphragm to below that vein that pushes blood supply out to my liver and my stomach. And that vein that goes out to my liver and my stomach is also going to be grafted and stented into the other one. Right now, it's not far enough to where it's going to involve my small intestines, the blood supply to my small intestines, or my kidneys. And what we're trying to do now is go in and repair this problem before it gets to that. And what the procedure that I'm going to have is called a TEVAR, T-E-V-A-R, thoracic endovascular aortic reconstruction. And I'm going to be in the hospital for about 3 or 4 days. I'm going to be in surgery for about 2 hours. Of course, I'm going to be knocked out on some. I guess they're gonna put me to sleep. I'm not gonna know nothing about what's going on, but she can't say exactly what caused this condition, except they know that smoking cigarettes or just smoking period is one of the main causes of vascular disease. And this isn't really a disease or anything. I mean, my veins are looking good. She said I didn't have any plaque built up in my arteries or any of that stuff, which was good. My cholesterol's super high, but that's workable. We can deal with that with some medicine. Right now, I don't know when the surgery is going to be. She's got to get with the whole team, and they have to coordinate this. I've got to go to Pensacola to the hospital there because they don't do it where I live. And going to be in the hospital for a couple of days, folks. I'm going to have some serious surgery done. And this aorta is right against my spine. So they're going to have to put a spinal drain. They're going to have to put a spinal tap in. They're going to tap into my spine and drain all the fluid out of my spine because of swelling. Okay, and they don't when the swelling occurs, that's what could cause paralysis. Okay, I could become a paraplegic or a quadriplegic or whatever. So they want to take all the fluid out and give it plenty of room to expand or swell, because there's going to be some swelling. I'm also going to have a drain in my spine for any swelling and any fluid that builds up in there to drain out, so it doesn't cause pressure on my spine and cause paralysis. And this is pretty serious, folks. I just couldn't hardly hold back the tears in the doctor's office when she was telling me that I needed to have this as soon as possible. And they are going to plan it as soon as possible. So I've got a couple tests that they need to run at the hospital here in Destin. They're going to send me for some ultrasounds. No, I'm not pregnant. they're gonna do some ultrasounds on my arteries, that my I guess they call it the carotid arteries and stuff that go up your neck and whatever. They're just going to do some preliminary tests and things, and then probably 2 days before the surgery, I'm going to have to go to Pensacola to meet with the surgical team, and we're just going to sit down for a meeting and go over everything and what's going to happen and how everything's going to go and what I need to do, what they expect from me, and what I need to expect from them, and what I should expect. A little nervous about this. I can't lie. It makes me nervous to think I'm going into surgery. This is major. I've never had anything this major in my life before. So, folks, that's just an important health update. If you smoke, quit while you can. Quit as early as possible. I quit many years ago, but obviously it wasn't soon enough because, I ended up with some serious problems. Right, very close to my heart. Gonna read the report to you real quick, so bear with me. I'm gonna read this first, just so I can get familiar with the words, and then I will turn the camera back on and read it to you the best I can. There ain't nothing to it. I'm just gonna read it, folks, okay? And I'm sorry if I don't spell, I can't read correctly or whatever, because I'm not a doctor, and a lot of these words I'm never gonna have seen before. So the technique was this is from a CAT scan, and the technique was a 3mm axial images were obtained through the abdomen and pelvis following bonus administration of the above contrast. That means when I went for the CAT scan, they put dye. They shot me up with dye inside my veins. Coronal and sagittal reconstructions were rendered. Three-dimensional surfaces rendered. Vessels analysis image of the abdominal aorta and its branches were also obtained. Findings: the included lung bases are clear. The liver, spleen, pancreas, gallbladder, adrenals, and kidneys are normal. The loop of the bowels are normal. There is no fluid collection. Adenopath, Adenopathy, adenopathy, or mesenteric, mesenteric, inflammation in the abdomen or pelvis. The bladder is unremarkable. There was no focal bony lesion. Then it goes on and it says aortogram, aortogram. There is fusiform aneurysmal dilatation delineation, dilation, of the proximal most abdominal aorta, beginning at the diaphragmic hiatus and continuing down to the takeoff of the SMA. I don't know what that is. I guess it's the vein that supplies blood to my stomach and other areas. The maximum transversal diameter of the abdominal aorta is 5.2 centimeters. This is not associated with any dissection or evidence of rupture. There is no stenosis of the abdominal aorta or its branches. There is a mild compression fracture of the T12, which demonstrates approximately 25% loss of vertical height involving the superior end plate. Now, they are saying that's a fractured vertebrae. It's not my T12, it's my L1, which they're mistaken because they don't realize, whoever was looking at this film or this scan, who they don't realize I have an extra vertebrae. So it's actually the L1 that has I've already come to that conclusion in previous MRIs and CAT scans, that it's the L1 that has the cracked vertebrae. So impression, fusiform aneurysmal dilation of the superior abdominal aorta with a maximum transverse diameter of 5.4 centimeters, approximately 25% compression fracture of the T12, L1 actually. This is age indeterminate. And they also found evidence of let's go on. They found evidence of a cracked, a broken rib that I had never been to the doctor for. A long time ago, y'all might have seen the video where I hurt myself at Bogs and Boulders and I had an accident on my four-wheeler. I'll put a link to that video right up here. And I was right. I had a broken rib. I thought I had 3 or 4 broken ribs the way I felt. I felt so horrible. It was horrible. But now it's confirmed. The CAT scan showed that I did have a broken rib. And I never went to the doctor for it because I knew that there was nothing they could do. So, folks, I'm going to have surgery. And I don't know when yet. So I can't tell y'all when. I'll just have to keep y'all updated and hope for the best. You know, anybody going into a surgery like this, there's a lot of chances that things don't turn out the right. You know what I'm saying? It's surgery. It's anesthesia, and it's the spine, and it's the heart, and it's the blood flow. It's just whatever. Anyhow, I just thought that I'd let everybody know the news that I got. I just wanted to keep y'all updated because I'm sure there's a lot of y'all out there that do keep up with my videos on a regular basis. So I appreciate y'all watching. For those that didn't know, I've had this condition for a little while now. I found out last year after the Rednecks Gone Fishing 2016 red snapper fishing trip. I got injured on that trip and had to go to the hospital for the cracked vertebrae. And during that trip, they found out that I also had a serious condition called an abdominal aortic aneurysm. Something I said just turned on my Siri. Anyhow, folks, Folks, if anybody's more interested in how this procedure is done, I'm going to put a vague, it's not really much in detail, but there's a video on YouTube that kind of explains a little bit about how the graft and the stent goes in. I'm going to put a link to that in the description below. So, but that doesn't show you the graphics of how they cut me open and all that stuff. It just doesn't show none of that, or my recovery time or nothing. It just shows you pretty much how the graft works, how the stent works, and how it's implanted. Check that description out. It's a pretty cool video.